My name is Anwin. I'm a PG11 pharmacy resident at Emory Decatur Hospital. Today I'm going to talk about the efficacy comparison between Poractant alfa and Calfactant in infants with respiratory distress syndrome. The following investigators have nothing to disclose. Respiratory distress syndrome, or RDS, is a common cause of morbidity and mortality in premature infants due to alveolar surfactant deficiency. Surfactant is composed of phospholipid, protein, and neutral fat. Phospholipid helps decrease surface tension in the air-water interaction area in the alveoli. Surfactant proteins B and C help with the extension and adherence of surfactant and phospholipid to the surface. There are 3 surfactant products approved for RDS in the US. Our study compared Calfactant and Poractant alfa. Compared to Calfactant, Poractant alfa requires lower volume of administration for the first and subsequent doses. Poractant alfa also has slightly higher concentration of phospholipid and surfactant proteins B and C, which theoretically would make it more efficacious for RDS treatment. There are limited studies directly comparing Poractant alfa and Calfactant, and some show conflicting results. This 2006 study showed that Poractant alfa is associated with significantly lower bedside administration time and more doses administered in less than 5 minutes over 3 years. However, there was no efficacy outcome. This 2018 study found that the average number of doses of Calfactant was slightly but significantly fewer than Poractant alfa after switching to Poractant alfa. Since they did not observe a consistently high rates of single-dose success with Poractant alfa after switching, they returned to use Calfactant. While this study is similar to my project, we focus more on comparing efficacy between the 2 products. Emory Decatur Hospital has a 52-bed level 3 NICU in which the care is provided by neonatal practitioners, trained nurses, and respiratory therapists. We recently switched from Calfactant to Poractant alfa in August 2019. The purpose of this study is to evaluate the recent switch of Calfactant to Poractant alfa as our NICU. The objective of this study is to compare the efficacy of Poractant alfa and Calfactant in neonatal RDS setting. This retrospective cohort case control study included premature infants born at 35 weeks or earlier who were admitted to the NICU with RDS and treated with either Poractant alfa or Calfactant. Infants with congenital defects and DC infants within 48 hours of surfactant were excluded from this study. Calfactant data was collected for 2 years prior to the switch, and Poractant alfa data will be collected for 2 years after the switch. I'm reporting the preliminary data for 7 months after the switch to Poractant alfa. The primary outcome of this study is the percentage of patients that require redosing. The secondary outcomes include mean FiO2 at 8 and 24-hour post-surfactant, extubation rate, reintubation rate, and overall cost. We estimated at least 100 patients per group were needed to detect 20% difference in percentage of patients that require redosing between surfactant groups. We stratified primary outcome by gestational age and birth weight for each surfactant. The preliminary result was based on 2-year data for Calfactant and 7-month data for Poractant alfa. There were 111 patients received Calfactant and 19 patients received Poractant alfa. The majority of patients were male and weighed less than 1.5 kilos. Calfactant had more patients born between 24 to 28 weeks, while Poractant alfa had more patients born between 29 to 32 weeks. More patients in Calfactant was intubated prior to treatment compared to Poractant alfa. We observed that the majority of patients in both groups only needed 1 dose of surfactant treatment. 32% of patients in Poractant alfa group needed 2nd dose compared to 34% of patients in Calfactant group. 5% of patients in Poractant alfa group needed 3rd dose compared to 9% of patients in Calfactant group. When stratified by gestational age, we observed that more patients in the extremely preterm subgroup treated with Poractant alfa needed additional doses. There was no difference observed in the percentage of patients needed additional doses between Poractant alfa and Calfactant across the birthway subgroups. The preliminary results show no difference in the mean change in FiO2 between the two groups at 8 and 24-hour post-surfactant. We also observed that there was a trend in which the mean change in FiO2 was the greatest after the first dose, while there was no difference after the subsequent doses. 14% of patients extubated within 48 to 72 hours post-surfactant in Poractant alfa, compared to 38% of patients in Calfactant group. 4 patients were reintubated in Calfactant group, while there was no patient were reintubated in Poractant alfa group. The average cost per patient for Poractant alfa was around $900, which is 71% higher than Calfactant group, which is around $500 per patient. In conclusion, our preliminary results show no difference in percentage of patients that require redosing after the recent switch to Poractant alfa. The main and major limitation in this study are time limitation that leads to the inability to collect adequate sample size in Poractant alfa group. It's only 7 months in the switch to Poractant alfa up until the end of March 2020. We only had 19 patients in Poractant alfa group, so we were only able to perform descriptive analysis at this point. In our early observation, Poractant alfa associated with higher average cost per patient without improving in number of patients that require redosing. Higher percentage of patients required redosing belong to the group less than 24-week gestational age and treated with Poractant alfa. We also observed that Calfactant associated with higher percentage of patients who were extubated within 48 to 72 hours post-surfactant compared to Poractant alfa. So the plan is to continue collecting data for Poractant alfa group in order to determine whether dose differences were statistically significant, and then we will be able to compare the efficacy between Poractant alfa and Calfactant. The self-assessment question: does switching from Calfactant to Poractant alfa reduce the need for additional doses? The answer would be, based on our preliminary data, there was no difference observed in the percentage of patients that require redosing. Early observations showed that Poractant alfa associated with higher average cost per patient without improving in numbers of patients that require redosing. I would like to acknowledge those people listed here. Here are my references, and that will conclude my presentation.